Hello, this is Dr. Silay. I'm your host, and I'm so excited and thrilled to be with you with WHN. WHN stands for World Health News. We have top news that I'm going to share with you today. Of course, our top news is live updates from coronavirus outbreak. And also we'll talk about e-cigarettes. Are e-cigarettes actually making teens more dependable? We'll also talk about why getting medically misdiagnosed is more common than you may think. And finally, digital dating abuse is on the rise, and teen boys are most at risk. So our first news is about coronavirus update. As you know, coronavirus is a new outbreak initially identified in China and continued to grow about the last 2 months after it was first detected. Now it is called COVID-19. The virus is on multiple coronaviruses that can infect humans. And it is one of the multiple versions that is also came out in Iran recently. So from China, around the world, it is going around. Of course, there are other examples, including SARS, MERS, and even the common cold. But the question is, how many people really have it? Over 76,000 people have contracted the virus, first detected in December. This month, China announced a major increase in the number of new coronavirus cases. Now dubbed COVID-19, in one day, they reported an increase of about 14,000 cases. The dramatic increase is due in part to a shift in how the virus is being diagnosed. Medical experts are now using lung scans rather than complicated tests that reveal the virus genetic structure. Those tests had been really difficult to access, according to the reports. China also revealed that more than 1,700 medical workers have contracted disease and 6 have died as of February 14. Over 2,200 people have died from the virus in total. The vast majority of people who have contracted it and who died are in China. In the United States, 15 people have been diagnosed with the disease. Additionally, 14 people who contracted disease while on a cruise ship in Japan have been brought back to the United States. Turkey has taken out all their citizens with a very successful operations from China. And more people have died from this new coronavirus in 2 months than in the entire duration of the SARS outbreak. However, the overall death rate is still much lower for this virus, around 2%, than the SARS virus, which is around 10%. Center of Disease Control Director warns COVID-19 may spread throughout the United States as well. COVID-19, the extremely infectious coronavirus sweeping through China's Hubei province, will become a common community virus in the United States. If not this year, then the next year. The CDC director, Dr. Robert Redfield, actually told this to the CNN. So this virus is probably with us beyond the season, beyond this year. And Dr. Robert Redfield thinks that eventually the virus will find a foothold and will get community-based transmission, said Dr. Redfield. Right now, Dr. Redfield and the team is in an aggressive containment mode, like the rest of the world. Also, Dr. Redfield emphasized that the CDC doesn't have any evidence that coronavirus is really embedded in the community at this time. But with that said, they want to intensify their surveillance so that they are basing those conclusions on real data. So, the virus gets a new name. The World Health Organization announced back in February 11 in a tweet that the new coronavirus will now be called COVID-19. Previously, it had been called 2019 nCoV. Although many media outlets refer to the virus simply as coronavirus, even though that refers to a larger family of viruses. Our second news is about the teens. The teens having symptoms of e-cigarette dependency are more and more likely to continue vaping and more often. Dependent symptoms for tobacco products include strong cravings to use, difficulty quitting, feeling addicted, and withdrawal symptoms such as irritability or difficulty concentrating. Teens who reported at least one e-cigarette dependence symptom during the first survey in 12th grade were more likely to still be vaping 6 months later. Nicotine is a very highly addictive chemical, as you all know, ladies and gentlemen. It's what keeps most cigarette smokers smoking. It may also drive young people, unfortunately, to continue vaping and increase how often they use e-cigarettes. So this is, unfortunately, backed by earlier research, trusted source that found adolescent vapers can develop nicotine dependence specific to e-cigarettes. So there is a new study, and this research provides that the most detailed evidence to date on e-cigarette dependence symptoms among teens, and shows how that dependence is connected to continued to vaping. E-cigarette dependence linked to continued vaping is clearly have been published, and JAMA Network opened in February 19. And the researchers actually surveyed 9th grade students in 10 participating public high schools in Los Angeles County, California. Students took the surveys twice a year from 9th through 12th grades, answering questions about their use of tobacco and other substances as well as their mental health. The fall survey in 12th grade also asked students whether they had experienced symptoms of dependence for either e-cigarettes or combustible cigarettes. 6 months later, students completed a follow-up survey. Dependence symptoms for tobacco products include strong cravings to use, difficulty quitting, feeling addicted, and withdrawal symptoms, such as irritability and difficulty concentrating. Researchers had full data on 444 students in 12th grade who reported using e-cigarettes in the past year, with or without nicotine. Slightly more than half of these past year e-cigarette users were male. Overall, a small number of vapers reported e-cigarette dependent symptoms. 11.7% of past year e-cigarette users and 17.6% of past month e-cigarette users. Dependent symptoms, though, were around twofold, higher in teens who smoked combustible cigarettes. The most common symptoms were similar for both types of tobacco products, such as cravings and urge. Some teens in the new study had higher rates of dependent symptoms. Those who had recently vaped used e-cigarettes with nicotine or were dual users of e-cigarettes and combustible cigarettes. In addition, teens who reported at least one e-cigarette dependent symptom during the first survey in 12th grade were more likely to still be vaping 6 months later. They also vaped more often and intensely compared with their peers who didn't have any dependent symptoms. This fits with an earlier study that found continued vaping is common, unfortunately, among our youth. In that study, more than 80% of teens surveyed were still vaping 1 year later. During that time, the number of students who vape daily had increased from 14.5% to a striking 29.8%. This study further suggests that youth with dependent symptoms are at elevated risk for continuation and escalation of vaping. So, therefore, in this study, the youth at high risk of nicotine dependence has been clearly shown that we should find ways to avoid vaping habits and find ways to avoid starting. Therefore, predictive and defensive medicine is more important than later on trying to intervene. And the researchers relied on students to report how often they used e-cigarettes, which may not be entirely accurate. They also surveyed students about e-cigarette dependent symptoms rather than using a clinical diagnosis. So while the researchers looked at e-cigarette dependent symptoms, the dependency is for the nicotine, of which the e-cigarettes are packed with, said Mo Galbart, PhD, Executive Director of the Thelma Macmillan Center at Torrance Memorial Medical Center in California. He was not involved with the study. However, he mentioned that clearly the nicotine is the key. So nicotine also drives continued use of combustible cigarettes for most smokers, but it's not something that can't be overcome. Cigarette smoking rates have been falling for decades in both American adults as well as globally. But over the long years of hard work, cigarette use by teenagers has decreased, Galbart said, in part due to the health concerns and in part because smoking was deemed as not cool. But e-cigarettes now is rising among youth. And therefore, Mr. Galbart says this is partially due to marketing aimed at youth. Flavors like mint, menthol, and fruit that make vaping more pleasurable, and the ability to easily conceal vaping devices from adults. These factors may make it more likely that youth start vaping. And once they have started, it's too late. Nicotine makes them keep coming again and again. Like alcohol, like heroin, like any other addictive substances, nicotine actually hijacks the brain's reward system. Because the brain isn't fully developed until around age 25, youth are especially very vulnerable to nicotine addiction because their brains are more sensitive to reward. The developing brain will cause stronger and more lasting nicotine dependence in many youth. And teens, unfortunately, will become highly addicted to nicotine, and many eventually will turn into cigarette use. Therefore, this new study didn't just look at how long it takes for teen vapers to develop dependence. That depends on many factors, including how often they vape, their genetics, and the amount of nicotine they are getting. So therefore, I want to congratulate the authors for this very important study, and I hope that this can be avoided. And my next news is about very interesting topic. Do you know that you have a potential that you are misdiagnosed? And why getting medically misdiagnosed is more common than you may think. Only in the United States, 12 million people are affected by medical diagnostic errors each year. And think about the global 8 billion people, the possibility of misdiagnosis. Only in the US, an estimated 40,000 to 80,000 people die annually from the complications from these misdiagnoses. Women and minorities are 20 to 30% more likely to be misdiagnosed. Darlene Anita Scott, 45, has been a physically active, healthy person her entire life. So it was a surprise for Darlene when the distance runner started experiencing fatigue and shortness of breath while training for her 7th marathon back in 2016. Darlene noticed that she was out of breath after just the first mile while she was training, but it wasn't something she was associating with anything wrong. So she had a pretty active professional life. She's a professor who was just promoted to an administrative position, and she was keeping an active research schedule and traveling as an artist. So she was keeping a very active calendar as a busy life, and she thought fatigue was coming from the busy part. But later on, who works as an associate professor of composition and creative writing at Virginia Union University in Richmond, Virginia, Scott just assumed that her hectic lifestyle was contributing to the fatigue. It wasn't anything too serious. That sense was compounded by the diagnosis from her primary care physician, who said she must have some asthma or allergies. So the physician gave her an inhaler prescription. With that, she assumed she had a clear answer for what was wrong, and she was happy. She was told that since she was a transplant to a new place, like many people who move from one part of the country to another, she was more susceptible to developing allergies and having allergy-induced asthma. So it was a diagnosis that didn't cause much concern to her. Whatever it was something small, she thought. And she thought it was something to treat today and get back to life. So she ramped up training, added new workouts, and since it was the summer and she didn't have to be in the classroom, she had reduced workload and she was able to sleep more, she said. So that summer, Mrs. Scott's fatigue and trouble breathing failed to quiet down. After an initial pulmonology test seemed to show her lungs to be in good shape, additional testing and a chest x-ray showed something else. A cardiologist eventually diagnosed her with heart failure, ladies and gentlemen. She had an enlarged heart or cardiomyopathy. Within the next year, she was given a pacemaker and also diagnosed with sarcoidosis, an inflammatory disease also associated with heart failure. So for Scott, learning she didn't have asthma and allergies, but a much more serious diagnosis was really jarring and life-altering event. First, it was like, let's fix this. I believed myself, she said, to be healthy, and she felt like she can heal herself quickly. But then she was a little bit angry because of her lifestyle. If she cannot do things that she used to do and supposed to do to be healthy, and she was asking, why is this happening? And there was a shock and anger and a little bit of denial. So these cases can happen. And we have to work very closely with our physicians to make sure these cases are not increasing. Our last news is about digital dating, the digital world. How does the digital world impact on our lives? Do you know that the digital dating abuse is on the rise and teen boys are at most risk? New research suggests digital dating abuse is on the rise. And experts say that boys may be actually at more risk. And the experts say that the research may be flawed in how it defines digital dating abuse, but that it still exists. It's important to talk to teenagers about the different types of abuse and what they should look out from at an early age. If you suspect your teen may be a victim or perpetrator of any type of abuse, seek help from a mental health crisis center or local law enforcement. A recent study that I want to share with you, ladies and gentlemen, came out from Florida. In Florida, the first of its kind to take a deep look at digital dating violence as it applies to teenagers. The findings were very surprising and shocking. Of the 2,218 middle and high school students that participated in the research, More than a quarter, 28.1% of those who had been linked romantically in the past year said they had also been subjected to digital dating violence. Boys reported experiencing more this abuse than girls, with 32.3% saying they had been victims compared to 23.6% of their female counterparts. So the study defined digital dating violence as a romantic partner doing any of the following: keeping them from using their devices, sending threats via text, posting content online to publicly make fun of, threaten, or embarrass them, posting a picture without permission. Ladies and gentlemen, this is our coverage of WHN. I'm your host, Dr. Silay. We will continue this amazing program through Astra 2G. If you have any questions, please post to our WhatsApp number. And if you are actually watching this show, take a picture with your family and send to our WhatsApp line, and we'll be happy to share it with you. And we continue this amazing hotline program with you. Take care, all the best.